Good morning, everyone. Today marks 9 months since Vermont's first fatalities from COVID-19. As we have on the 19th of every month since, I've ordered flags to half-staff to honor their memory and remind us why the sacrifices we're making are so important. On this day, I ask all Vermonters to think about the 193 Vermonters we've lost. Think about those who love them, friends and family of members left behind. And think about the responsibility each of us has and the choices we make to help protect those who are vulnerable due to their age or certain health conditions. I'm really proud of how Vermonters have stepped up to do their part. That's why Vermont continues to have one, if not the lowest death rate in the country. And fortunately, we've seen a significant decrease in deaths and hospitalizations since January. Our vaccine strategy is a major part of this as well, but it's up to each of us to keep this moving in the right direction, and that means following the public health guidance. Now, I know we're all getting tired of it, but the better we do now, while we continue to vaccinate those at greatest risk of hospitalization and death, the faster we can get back to normal. About 95% of Vermont's deaths have been people over 65. So every dose that's diverted from this population puts them at risk and slows down our exit strategy, because after the oldest Vermonters and those with certain conditions are vaccinated, our healthcare system won't be at risk and fatalities should be rare, and we can begin to return to normal. And as a reminder, Vermont has one of the oldest populations in the nation, which makes our strategy even that more important. Fortunately, we're making great progress. And since we opened registration to those 70 and older on Tuesday, over 21,000 in that age band have already signed up, which means we'll be able to open to the next phase very soon. Next, I was asked Tuesday about the status of the Vermont National Guard deployment to Washington, D.C. I'm happy to report our mission is complete and our soldiers are returning home this weekend. As a reminder, I approved this deployment just over 1 month ago because states were asked to help ensure the peaceful transition of power following the violent insurrection at our Capitol. We were asked to extend the mission because of their performance and professionalism. We should all be very proud of how they represented us so well, and I want to thank all the members of our Guard for their service and for helping defend our most basic democratic principles. Finally, we're announcing a couple of changes to our guidance today. Smith will talk about changes to long-term care facility protocols as we complete vaccinations of residents. And as I previewed on Tuesday, we're announcing a change to our travel policy. Earlier this month, the CDC issued encouraging new guidance around quarantine for those who have been fully vaccinated. As a result, we considered the impact this would have on our guidance. And as a result, we found many things it could impact. There are literally dozens of what if and what about questions. And we started working through a number of these. But I want to be very clear. We're going to do this carefully and methodically, like we have throughout the pandemic. And I'm asking for your patience as we work our way through this. So today, I can announce one significant step forward relating to travel. Effective this Tuesday, those who are fully vaccinated, meaning 2 weeks after their second dose, will not need to quarantine after that travel. This also means those who come to Vermont from other states will not need to quarantine if they can prove they have been fully vaccinated. Of course, they'll still need to comply with all our other health guidance like masking and distancing. Again, this change is very narrow, focusing on travel. And I know there will be a lot of questions and some head scratching about why this is allowed while other things are not. But the fact is, every step we make comes with questions, and we're taking it one step at a time to lessen the confusion. The next step we're working through is how vaccinations will impact multi-household gatherings. And we're also looking at returning to a trusted household policy. And we'll have further announcements next week on those issues. I hope you see this as I do, because it's incredibly encouraging news, as it means the light at the end of the tunnel is getting bigger and brighter. We're one step closer to returning to normal, and as more and more Vermonters receive their vaccine, we'll make more turns of the spigot. Again, I know this raises a lot of questions, and we'll address them methodically, but please understand, we're going to take this one step at a time and continue to be guided by the science, the data, and the advice of our experts. So with that, I'll turn it over to Secretary French for our weekly education update.
Thank you, Governor. Good morning.
I think you're on mute, Dan, or we're not hearing you.
Hear me?
We still can't hear you.
Hello?
We're starting to hear you now.
Hello?
Yeah, we can hear you, Dan.
Okay. Okay, thank you. Sorry about that. Good morning. I will begin my report with an update on our weekly surveillance testing of school staff. About half our schools were on winter vacation this week, and the other half are out next week. This made the logistics behind the testing a bit more complex than normal. Some of the testing had to be rescheduled. That being said, we administered 620 tests this week, which is about a 26% participation rate. So far, no positive cases have been identified, so the positivity rate is 0. Statewide positivity rate is 1.8%. We collect monthly data from our schools as to what extent they're offering in-person, remote, and hybrid learning. The data from the January survey were recently published, so I thought I'd provide a summary of this information. The data continue to show a great deal of stability in the operations of our schools. In January, 55% of all schools were in hybrid mode, 30% were in person, and about 15% were fully remote. When we break this data down by grade level, we continue to see about half our elementary schools were operating at full in person. 25% of our middle schools were in full in person, and 10% of our high schools. Again, I think the major conclusion from these data is school operations have remained fairly stable. January in particular was a very challenging month in terms of virus activity in our communities, and in spite of these conditions, over 80% of our schools were able to maintain some degree of in-person instruction. I think we can draw two conclusions from these data. On the one hand, the mitigation strategies required of our schools work, and on the other hand, our schools have obtained operational fluency in implementing them on a daily basis. I think it is important to acknowledge that the achievement of this stability requires a tremendous amount of attention to detail in mitigation fundamentals and in communications. It takes a lot of hard work on the part of state employees and school staff and the active support of students and their families to make this all work. The success of our school operation is a direct result of their dedication to their schools, the students, and our communities. The CDC released updated guidance for schools last Friday. The U.S. Department of Ed also released companion guidance to support schools with implementing the CDC guidance. After initial review, I do not expect the new federal guidance will have much impact on Vermont's guidance for schools for now. The new CDC guidance seems to be directed more at those places in our country that never reopened their schools or are just starting to do so. We remain confident that our guidance is well designed and works well since we have a very good testing system in place, both among the general population and among school staff, and the results of the testing consistently demonstrate our success. We had scheduled a normal review of our guidance this month, so our team will evaluate the federal guidance very closely and to see if we can improve ours in any way. On another topic related to federal guidance, we continue to examine our options for implementing the SBAC achievement testing this spring. Our options in this regard are highly limited to what the U.S. Department of Education says they are, since these tests are required under federal law. Last spring, a national testing waiver was issued. We are expecting the U.S. Department of Education to issue guidance on testing for this spring, but probably not an outright waiver. It is not clear, however, as to how much flexibility they will impart to states in their guidance. We have seen a few states pursue waivers of their testing under the general waiver authority of the Every Student Succeeds Act, or what's called ESSA. We do not believe any of these waivers have been approved, however, and it is not clear if the general waiver provisions of ESSA are appropriate for the specific circumstances of the pandemic. On the one hand, we remain interested in having data for the patterns of student achievement in our state, especially since our students have experienced a variety of learning settings over the year, and the data could be very useful for us in targeting and focusing our work in the recovery phase. On the other hand, our test, the SBAC, and not every state gives the same test, but our test, the SBAC, takes a significant amount of time away from direct instruction, in many cases more than a week. We are concerned that this would be too much of time away from direct instruction at a time when more in-person contact for all students needs to be a priority. If we are provided some flexibility in our decision-making, our priority on maximizing in-person instruction will likely be the most compelling consideration for us in deciding whether or not to hold the testing this year. We should know more on this in the coming weeks. That concludes my update. I'll now turn it over to Secretary Smith.
Thanks, Secretary French. Good morning, everyone. As many of you know, as of Tuesday, February 16th, any Vermonter age 70 and older can make an appointment to receive their first dose of COVID-19 vaccine. We received an overwhelming response this week, and as the governor said, as of today, 21,400 Vermonters age 70 and older have made appointments through our community vaccination program since Tuesday. If you wish to make an appointment to receive a vaccine and you are 70 years old or older, please visit the Health Department website at healthvermont.gov/myvaccine or call our call center at 855-722-7878. We've also added additional vaccine appointments for next week in Essex Junction, St. Johnsbury, Rutland, Brattleboro, and St. Albans. If you would like to make or change an appointment to make it sooner, please call our call center at 855-722-7878. In addition, those 65 years old and older will be able to make an appointment as early as the first week of March. I would encourage this age group to go online at healthvermont.gov/myvaccine and set up an account ahead of time. So when we announce a date to register, you will already have an established account and can simply go to the account and pick a place, date, and time to get vaccinated. Now let's look at our progress with the community vaccination program. Over 83,000 eligible Vermonters have been vaccinated against COVID-19. 41,000 Vermonters have received their first dose, 42,000 have received their second dose. So far, 58% of Vermonters in the 75 years old and above group, and 9% of Vermonters in the 70 to 75 years old and above group, as well as 1,100 homebound Vermonters have received their first dose of COVID-19 vaccine. This week, vaccinations for homebound individuals will occur in every Vermont county. Our planned allocation for next week is 720 doses, with the assistance from hospitals, primary care offices, and area agencies of aging. Our home health and EMS partners are working to identify homebound community members that do not receive home health services. As you may know, the state of Vermont has worked to protect some of the most vulnerable Vermonters living in long-term care facilities against severe illness or even death. In fact, out of the 193 deaths that have occurred in Vermont from COVID-19, 125 were residents of long-term care facilities. Many of these residents were the first to see restrictions placed upon them back in March of 2020. And although we've loosened restrictions in the summer of 2020, we had to tighten things back up again in the fall and into the new year when we had multiple outbreaks and unfortunately deaths in our long-term care facilities. As we continue to roll out a successful vaccination strategy in our long-term care settings, and as we see the corresponding reduction in the number of outbreaks and deaths in those facilities, we are able to reevaluate our recommendations and ease some of the restrictions that those residents have experienced over the course of the pandemic. Now, we feel safe. We feel it's safer than it has before because of our ability to vaccinate some of the most vulnerable Vermonters. All of our skilled nursing facilities have received both the first and second dose, and in terms of all skilled nursing facilities, assisted living facilities, and residential care facilities, 93% of residents have received their first dose, and 74% have completed their second dose. Nearly 3/4 of staff have completed their first dose and half have completed their second dose. We're happy to announce that next week, effective February 26, residents living in long-term care facilities in areas where there have been no COVID-19 outbreaks will be encouraged to follow the following guidelines. Encouragement to use full vaccination status as a factor, but not the sole factor, in planning for such things as congregate activities within a facility. This means beginning to allow congregate settings if the facility is within the CMS, or Center for Medicare and Medicaid Services guidelines for county positivity rates. This means eating together and participating in other group activities within guidelines. On a case-by-case consideration, safe physical contact and recommendations for allowing that contact in specific circumstances, which includes full vaccination status. Some modifications to quarantine requirements for residents, and with full vaccination, having visitors indoors, participating in non-medical essential services such as salon appointments. Just for information purposes, fully vaccinated means greater than or equal to 2 weeks following the receipt of the second dose in a 2-dose series, or greater than or equal to 2 weeks following receipt of 1 dose of a single-dose vaccine. While the Center for Medicare and Medicaid Services, CMS, have not issued new regulations for long-term care facilities, these updated recommendations reflect progress made with our vaccination efforts for residents and staff. It's important to note that CMS continues to require staff surveillance testing in CMS-certified skilled nursing facilities based on the prevalence of COVID-19 in individual counties. And equally important, our updated guidance continues to highlight safe practices related to infection prevention and control. Even as we move through the successful vaccination process, we want to ensure that we are providing the safest and highest quality environment for Vermont's long-term care facility residents. We will continue to work closely with CMS and CDC to monitor changes in regulations and to translate those practices right here in Vermont. We are happy to announce this milestone, but it's also important to maintain necessary safety precautions such as wearing masks, hand washing, and keeping a 6-foot distance. The Department of Disabilities, Aging, and Independent Living and the Vermont Department of Health have collaborated with our facility partners on this updated guidance, and I want to thank everyone for their work to make this guidance successful. I also want to change to another subject. I want to provide an important update regarding a federal initiative called the Farmer to Family Food Box Program. In the month of February, the USDA program has had significant challenges with the food box distribution program. The governor has instructed me to fix those issues so that this federal government program is as seamless as it was once in distributing food to Vermonters. In the coming weeks, we will intervene and work with the USDA and partner with the Vermont Food Bank to ensure these supplemental food boxes are distributed equitably to Vermonters. As a result, food boxes will be ready for Vermonters to receive them on March 1st. Like other farmers to food box rounds, you can use the online registration system to receive a food box. The website is humanresources.vermont.gov/food-help. Beginning next week, the website will be updated with available days and locations for March. Those without internet access can call Vermont 211 to register. And now I'll turn it over to Dr. Levine for a health update.
Thank you. Today we're reporting 97 cases. We're down to 37 patients in the hospital. Positivity rate 8%. And on Tuesday, fortunately, the higher rate of spread of the virus has improved in Bennington and Rutland counties. School, which was discussed on Tuesday, is a good example. As I reported, only 3 cases there were associated with the school, and these were connected with 2 small sub-outbreaks at area farms. Transmission may at times be difficult to trace, but quite often the school is either part of a chain of transmission involving work sites or households, or just an unfortunate bystander. The major theme I want to convey is that the virus is in our communities, and that is how it gets into our schools and workplaces, so we must always be cautious and careful. Now, this school did choose to go remote before their vacation, mainly because of staffing needs. As I've said many times, schools go remote for a variety of reasons, some public health related, and some pragmatic and necessary, such as staffing issues brought about by the number of staff needing to either isolate or quarantine due to exposures. So even though we are sick of this pandemic, and even though many of us anxiously await a chance to get the vaccine, the virus is still a threat, and we need to stay focused on keeping it from spreading. Avoid gatherings in crowds, wear your mask, and if you have any reason to get tested, please do it. It's easy and it's free. I've discussed here the new testing opportunities we added in Bennington County after we started to see higher rates of COVID in that area. As part of these efforts, we also offered pop-up testing at local ski areas, Bromley and Stratton. The testing was offered to anyone who wanted it, whether employees, skiers, or even local residents. We now have data from this past weekend, and though it is a very limited snapshot, I do want to emphasize that, I will share what we found. At Bromley, 148 people were tested through antigen testing, including a small number of staff. About 38% had a Vermont address, 62% were from outside of Vermont. Bromley was a great partner in this effort, and officials there said the overall response was very positive. We heard that several guests, after getting tested, went to get family and friends they were there with to get tested as well after learning it was free. At Stratton, through another great partner, Stratton Mountain Urgent Care, 79 people were tested through PCR testing, 35% with a Vermont address, 65% out of state. Testing was also encouraged for staff, and 180 people tested. Out of all of these experiences, only a total of 3 positives were found. Keep in mind, antigen results need to be confirmed with a PCR. Now, keep in mind, we don't want to draw final conclusions from one weekend's testing efforts with one self-selected sample. But I did want to provide this preliminary data, and we were glad to see that people were receptive to testing at ski areas and plan to offer testing again this weekend at both areas. We thank the resorts for working with us and supporting the communities in these efforts. As we continue to race to suppress the virus, we know that the emerging variants could make our work even harder. Our public health response won't change, but we do need to strengthen it, encourage better fitted masks, strict adherence to physical distancing, and keeping social contacts as few as possible. But these prevention steps we ask Vermonters to take are not the only tools at our disposal. We can ensure that our testing, tracing, and outbreak prevention and response strategies are robust, and that we can support people to isolate and quarantine when necessary. Vaccination also, of course, plays a role, as we really need to get out in front of these emerging variants as quickly as possible. The less the virus is able to be transmitted from person to person, the less the virus can mutate, and the less chance there is for a more virulent strain to occur. And finally, policies are also another lever, such as the CDC's new order requiring masks on all public transportation. These can play a key role. You just heard Secretary Smith talk about the new guidance coming for long-term care facilities. I first want to emphasize and reinforce the very positive public health data from this sector as a great illustration of the potential for vaccination to markedly impact people's lives and lead us gradually into the future that we're all eagerly awaiting. These slides are updated from Tuesday's presentation. First, you can notice, of course, that we're having marked decreases in active cases throughout the state of Vermont. And in the next slide, looking at our cohort of over 75 years old, a 75% decrease from mid-January. Keep in mind, vaccination began in this later part of December, and this is where we're seeing now a significant effect. Note here in terms of new cases and new vaccinations, the rolling 7 days average. The yellow are the cases, the blue are the vaccinations. Vaccinations going up nicely at a very accelerated pace, and the caseloads obviously coming down dramatically. And then finally, we are also noticing a marked impact on deaths over the same time period in our state. This is all deaths, but as we know, the majority of deaths are occurring in the older age ranges, and you can see visually the dramatic impact. I just want to echo some previous comments that we certainly recognize the toll separating residents from their loved ones has taken. We're glad vaccination efforts have been so successful in these facilities that it can help residents feel safe while making it possible to have greater freedoms in connection with others. Whether they're visiting with families, eating meals together, participating in group activities, we believe facilities can set a path forward and still maintain the safety standards we've all been dedicated to throughout the pandemic. The remarkably high uptake of vaccine is obviously able to work in the facility's favor. The other good news is that CMS regulatory language pivots off of the disease activity expressed as percent positivity rates in our counties. With rare exception, our facilities are free to be ambitious in implementing successive layers of freedom. The hope is that the aggressive posture that allowed us to protect people in these facilities can now just be as aggressively reversed to improve everyone's quality of life. But clearly, we will still guide the long-term care facilities' use of the safest infection prevention and control practices and testing protocols. But imagine how differently a single positive case of COVID might impact such a facility in the post-vaccine era, with such a high proportion of the residents protected. I have just one update on the vaccination front. Secretary Smith has already noted we're aiming to expand vaccination further to the 65 and older age group soon, and as you know, the next age group beyond that will be people with high-risk medical conditions. I can share that we are adding type 1 diabetes to the list of conditions that will be eligible for vaccine in this high-risk group. It won't be viewed any differently than type 2 diabetes, which is already on the existing list. For my final comments, I want to end on a note unrelated to COVID, but in the news. Several winter storms have left millions of homes and businesses without power across the country, and people have taken to using alternate power sources, such as gas generators or grills for cooking and heating their homes. This has led to a surge in carbon monoxide poisonings in places like Texas, as using these sources can lead to carbon monoxide buildup inside homes or garages. In Vermont, we may be more used to winter storms, but we can still face the same dangers. I'd hate for the message to get lost during the pandemic that we need to be cautious about carbon monoxide poisoning, a message we deliver traditionally several times over the course of a winter. It still turns out that dozens of Vermonters go to an emergency room each year for carbon monoxide-related symptoms. So if you lose power, never run a generator, grill, camp stove, kerosene heater, or other fuel-burning equipment indoors. Be sure to clear any snow away from vents of fuel-burning equipment so they don't get blocked. Never leave a vehicle running inside a garage, even if the door is open. And make sure you have a carbon monoxide detector and alarm in your home. The symptoms of carbon monoxide poisoning are headaches, dizziness, weakness, upset stomach, vomiting. These symptoms can be confused with the flu. Go outside immediately to get fresh air, then dial 911 if your carbon monoxide alarm goes off or you suspect carbon monoxide poisoning. Thank you.
With that, we'll open up to questions.
We'll start with Calvin.
Thank you, Governor. Probably a question for Secretary Smith about long-term care. So just a quick clarification. So these visitation policies, is this just for people within long-term care, or if you have somebody that's in long-term care but their spouse is living at home, can they still see each other? I guess I'm just looking for a little more clarification there.
Sure. When we've sort of became more liberal in the recommendations, obviously vaccination of the resident is one of those considerations that we put in. We're leaving it up to the long-term care facility to decide what the vaccination sort of requirements are for individuals coming in to visit. But I would assume that they'll be if you're not vaccinated, I would assume that they're probably going to allow visitation along that line. So does that answer your question? So if you're an individual, you're a relative of somebody that's in a long-term care facility and you're not vaccinated, our expectation is you'll be allowed to visit.
Will be, okay. Regarding the winter storm Dr. Levine talked about, actually Secretary Smith, this is probably for you too. I'm wondering if we're going to see any of our vaccine allocations potentially delayed in the next few weeks as well. There have been, problems at airports and whatnot.
We have not seen our vaccine delayed where it has impacted us. As I have previously mentioned, we have about 1,000 doses in reserve that we use for this specific purpose, that if there's a disruption in the supply line or if there's a need like a spoilage or something along that line, that we can step in and not cancel clinics. We don't anticipate canceling any clinics right now because of the weather.
And then just last question, a few weeks ago you mentioned that you were in discussion with the NEA about, vaccine prioritization after the age banding. I guess I'm wondering, if anything has come from those discussions yet, or sort of an update on that.
Yeah, I would describe them as cordial discussions. I think the leadership of the NEA and myself and the governor want the same thing, is that kids want to get back to school, parents want kids to get back to school on a 5-day-a-week, full-time basis, and teachers. I mean, everybody wants the same thing. So we have the same objective. As the governor has mentioned, there is a phase 6 that we're anticipating right now and trying to figure out what we're going to do with phase 6. Phase 5 is what Dr. Levine just talked about when he talked about type 2 and type 1 diabetes. Those are with people with serious health conditions, underlying serious health conditions. We're still in discussions on what we're going to do with phase 6. But I can say that we're both looking for a path forward on where we're going to go with those vaccinations and having pleasant and positive discussions.
Thanks.
Steve?
Yes, this could be for the governor or Secretary French, probably. With the federal guidelines that have come out, there was the thought out there that it may alter. You're saying it's not going to alter the state's guidelines, but I believe the state's guidelines right now for all grades is 3 feet between desks, and I think the national is 6, which is double that. So, are there little tweaks that are going to be going on, or how's that going to work?
Again, I'll let Secretary French answer this, but those are just what they reflect, guidelines. And as Secretary French had said, they were mainly aimed at those who haven't opened up at all. We've been open up since the beginning. In fact, 30% of our schools at this point in time are in person, I believe, 4 to 5 days a week. And then we have about 20% which are remote. The rest, 50%, are hybrid. So we've already proven ourselves in some respects, and we don't intend to change our guideline at this point in time. But Secretary French.
Yeah, thanks, Governor. Just to reiterate your point that, we've had success with what we're doing. And just to clarify, we have 3 feet at grades K through 6, but 6 feet in grades 7 through 12. And when we made that decision very early on, based on what we're seeing internationally and the science, if you will, that younger students are less susceptible to the virus or its transmission. So that stood us well. And once again, I think the other side of that is we have confidence that what we're doing is working, because we have pretty substantial testing, and particularly surveillance testing on a weekly basis in our schools. So I think we'd know if it wasn't working well. So we I think will remain on our track that we are and monitor our progress. But certainly, as I mentioned, we welcome guidance like the CDC's. I mean, anything we can learn to improve our approach, we're definitely open to. So we'll continue to partner with folks at the national level to improve what we've done, and also to share what we've done, because it stands the other piece of CDC guidance, it stands out that many of the things we're doing are now incorporated in the national guidance, which is good to see.
And thanks, Mike. And as far as the reopening, the turning of the spigot, where are we at now? I mean, the numbers are looking pretty good. Businesses, some of the businesses are at 25% still. I think hairdressers and some other folks are. Do we see another little turn there at some point here?
Yeah, again, I think the announcement today is a huge change in terms of travel. This is going to have a beneficial effect on many. For those who are Vermonters who want to travel to visit, let's say, go to Maine, maybe do some snowmobiling or do whatever they want to do, they can travel and come back without quarantining. So this is a big improvement, and we're going to have to see how this works. We're going to work next week, as I said before, on trusted households and further refining what this means when you're vaccinated. So, but you can expect, as we continue to see the numbers go in the right way, as we're experiencing right now, that we'll continue to turn the spigot just a little bit more every week, we hope.
Well, that's, along those lines is what I was talking about, the planning process for a lot of these events that are going to be coming up as we get further into the year. Where are we at as far as that goes? I mean, you know,
Again, we'll provide clarity as soon as we have some comfort as to where we're going. I mean, there's still, you know, again, positive developments in many respects, but there are also some areas that give us a little bit of pause, and we just want to make sure we're doing it for the right reasons, so we don't have to go backwards. We want to keep moving forward, and that's what we've done since the very beginning. I believe, has done well for us in some respects, and we'll continue to do that.
thank you.
Stewart, NBC5.
Good morning. In light of the bump in federal vaccine supplies coming into the state, I wonder if you have any sort of more insight. You said that 65 plus will open the first week of March, week after next, and then those with the list of chronic medical conditions following that. When do you think the general population might expect to become eligible?
Well, again, we're going to consider that next phase after we finish with the health conditions category, but that's a fairly significant population. I'm guessing it's around 75,000 at this point in time. So we have a little bit of time to determine where we go next. But you know, the age banding, from my perspective, has worked very well. It's not confusing. People know where we're going, and it's easy to administer. So again, we'll you know, weigh that all out before we make an announcement on where we go next. But we want to get people through as quick as possible. I think Dr. Fauci had said this past week that we might be able to have most of the population done midsummer. So I think we're falling in line with that, and we're hopeful. We continue to build on the supply and what we're seeing from the manufacturers, increasing their inventory and supply and getting them out to the states is positive news. And we'll continue to work with the federal government to make sure that we receive our share.
Okay, let me ask you a political question second, Governor. A young man named Colby LaMarche resigned his position as chairman of the Burlington Republican Party and from the Vermont Republican Party last night, and in a letter that has been made public, decried what he called the unfortunate truth that the Vermont GOP has now been hijacked by far-right extremists who have attached themselves to what he called the extremist former president. And so he felt he has no chance but to leave, and said the party is headed for electoral disaster as a result. Do you agree with him? Have you spoken with him? Is this sort of the way you see things as well?
I have not spoken with him. I read that account. I think it's unfortunate. You know, a younger person involved in the Republican Party is good news, and I appreciated all his good work. What we see, you know, whether it's a Democrat or Republican, you know, you see the extremes of both groups at the party level and beyond, and some of their voices are very loud. But I still believe the vast majority of Vermonters on both sides of the aisle are in the majority. I think it's that centrist, moderate voice that a lot of us will react to. And that's where I see us going in the future. But again, acknowledging that those voices are loud, and from his perspective, he didn't feel he had a role to play. But I'm hoping in time that he'll be able to come back.
Thank you.
Sean, the Chester Telegraph.
Thank you. I think this is for Secretary Smith. We're hearing stories about some geographic problems in scheduling vaccine appointments here in southern Vermont. For example, we heard from an 80-year-old from the Chester area who was scheduled in Montpelier, which is a 200-mile round trip. Also, someone who was scheduled who wanted to go to Springfield and ended up in Windsor. And at the same time, we're also hearing that there have been people from Chittenden County who've been scheduled in Windsor County. A lot of people are saying that the people at the call center don't seem to understand the geography of Vermont. Are you hearing these stories, and is there a plan to fix this before opening up to larger numbers? And also, are there plans for more clinics opening in the southern part of the state?
Yeah, thanks, Sean. I have not heard of those complaints. I mean, if you're online, you choose your own location. If you're calling into the call center, we do have Vermonters that are manning those call centers. Not, we have also Maximus, which is what we use for Medicaid as well, manning some of the call center as well. But we do have Vermonters that are also doing that. But Sean, I'll look into that. I have not heard. I've heard of a few instances, but not sort of an overwhelming complaints that people are having problems finding vaccination sites near to their facility. And if we have an issue, I will straighten it out.
Thank you.
Guy Page, Chronicle of the Vermont State House.
Governor, today's reopening of travel raises questions about what will be the state's response to people who decline vaccination. Yesterday, a bill was introduced to prohibit loss of employment, educational access, and travel for non-vaccinated people. Will the state allow employers and schools to require vaccination for employees and students?
It's a great question, Guy. I think I said probably a month or two ago at one of these media events that this was going to be a dialogue. We're going to have both on the state level and the national level what this means to us. And I would just say that we have to have the conversation. From what we announced today, I think it's quite clear you have to be vaccinated in order to not quarantine when you're coming back in the state. It doesn't mean that you can't leave and come back, but you have to quarantine once you do if you're not fully vaccinated. So, but again, these questions are topical, and I believe they have to be discussed. But I'm not familiar with the bill that you referenced.
Okay. Thank you. 2 years ago, the state of Vermont replaced in full the Title X family planning funding lost by Planned Parenthood when the Trump administration said abortion providers no longer qualified. If, as seems likely, the Biden administration restores Title X funding, will you recommend the legislature remove the estimated, I think it's about $800,000 in state funding?
Again, if the federal government is going to provide funding, then we would take advantage of that so that we didn't have to utilize state money.
Okay. Thank you.
Liz, Burlington Free Press.
Hi there. My first question is a clarification question for Secretary Smith on the long-term care facility guidance. You said that one of the factors that should be considered is whether the facility had an outbreak or not. And I wonder if you were referring to like having a current outbreak or an outbreak at all during the pandemic. I'm thinking of like a facility like Burlington Health and Rehab who had their outbreak back in like March 2020. Would they be ineligible for these reopenings?
No, it is a current outbreak, an ongoing outbreak, not something that's happened previously.
Okay, thank you. And I'm not sure who this question is for, but we had a reader write in. He is 63 and has chronic conditions, and he's wondering if there's been any updated guidance as to, when his bracket comes eligible for vaccination, whether he will have to prove that he has those conditions, and if so, how.
Yeah, I just announced that the first week of March, we're doing 65 and up for an age band. The next band will be those with underlying conditions, with serious underlying conditions. There will be a verification process in that. It will be in the drop-down menu in terms of you will have to self-attest, and then there'll be a verification process from there. We'll outline that as soon as we have the IT program all put together, which is in progress right now. So that can give you some indication that we're coming up onto this age band next month in a fairly rapid way. So I would just ask your reader to stay tuned. It will be self-evident once they sign on, either through the phone system or through the or through on-site, but there will be a verification process. It will be,
Okay,
by the
thank you
way,
very much.
by the way, it will be fairly, it will not be intrusive to the person that's signing up. There's a lot of things that will happen behind the scenes on the verification.
Thanks very much. I appreciate it.
Mike Donahue, the Islander.
Thanks, Rebecca. Excuse me. First question, and this may go to Mike Smith and maybe the Commissioner, Dr. Levine. First question centers on the COVID traces found in the wastewater system dumped by the city of Burlington into Lake Champlain. I've yet to see any public discussion about the impact that those COVID strains might have on drinking water for those communities up and down Lake Champlain, both in Vermont and New York State, as obviously the primary source for their drinking, cooking, cleaning water, whatever. What is the state doing to help each town or water district make sure its water is safe for Vermonters to use?
Mike, thank you. I would want you to differentiate the variant strain from the regular, we'll call it the regular strain, because it's all virus either way. And so the assumption that's been made is that it doesn't really matter what strain of the virus, or what virus for that matter. The water treatment plants are still operating the same way they always operate. So I don't think people should be fearful of getting the variant strain of coronavirus from drinking the water any more than they should be fearful of getting any strain of coronavirus that currently exists from drinking the water.
Granted, maybe I made it too specific, but what are they doing to make sure that the water is acceptable?
Right. I mean, my understanding is nothing during the pandemic has changed from their normal chlorination and other processes that they would use, because in the end, that is virucidal, if you will, no matter what the virus.
Okay. And maybe for you or Secretary French, I'm wondering what you know about the new outbreak in the South Hero school system. We continue to be asked also why the state continues to ignore teachers in the list of those getting shots. Most states make teachers priorities in getting schools fully reopened. I think somebody mentioned, I think Mike Smith may have, I didn't hear Calvin's question, but some see this as especially troublesome that teachers are taking a back seat, especially at least one hospital allowed its lawyers and others in risk management that have no contact with patients to get private shots. But, I've yet to see a target date for teachers that are out on the front lines, and certainly probably goes to the same for grocery stores. They can't get shots, but those who are working in pharmacies can. So what have you heard about South Hero, and when can teachers, is there a date certain that you're shooting for?
Yeah, I have no special insights on South Hero. I'll leave that to Secretary French if he has any knowledge on that. And I believe both the governor and Secretary Smith have pretty exhaustively answered your question regarding the discussions that are going on and the things that are on the table and the mutual progress people want to make towards getting to an agreed-upon goal. But I'll let Secretary French speak for himself.
But I haven't heard a date. I mean, they're talking down the line, but everybody's going to get it down the line. Is there a date, target date for teachers?
Hey, Mike, this is Mike Smith. We had mentioned that we're looking at phase 6, which is, if you were sort of mapping this out, I think you would see 65 and older on the first week of March. I would think you would see the start of the aspect of those with underlying conditions about mid-March, and then we'll start looking at phase 6, which we've been having discussions with the heads of the teachers union on that specific phase and what we're going to do. There's no time frame. There is something that's going on that will be coming out next week that I've already talked with the head of the NEA on, and that is we're going to be sending out a survey to teachers and school personnel and childcare to make sure that we have an accurate number of what our needs are going to be for vaccines for those groups. There's no promises here, but we're looking at those groups in terms of what we need to do for planning. So if I was adding all those up, I would say that it's coming, but I don't have a specific date for you.
And Mike,
Okay,
just to
and
follow up,
yeah.
I don't have any specific information on South Hero either.
Have you been told about it even?
Just in sort of our generic reporting, but I don't have any specific information.
I mean, when will you get an update on the outbreak?
I generally don't have updates on specific circumstances like that. We just look at the general data. Periodically, I do have superintendents or principals make me aware of their situation, particularly if it's complex from an operational standpoint. But generally speaking, I don't get an email or a call from every principal anytime they have a case in their school. I do see the aggregated data through our reporting system.
But when they shut down a whole school, you aren't notified?
Not necessarily.
Really? Okay. Thank you.
Greg, the county courier.
Thank you, Governor. Good afternoon, thank you, Rebecca. Good afternoon, Governor. First off, I wanted to thank you for getting me the list of outbreaks in Vermont. I noticed on that list, I see a school that had first identified an outbreak on February 5th, and yet 7 days later they hosted a varsity basketball game. Obviously, the state hasn't been transparent to people to let them know that each school has identified a new outbreak. But I'm wondering, as far as participants at that game, is the hosting school notifying the visiting school that they've had an outbreak, and is that visiting school notifying parents that they're busing their kids to a school that's had an outbreak?
Here's what I do know, and I'll let Secretary French add to this, but if there's an outbreak that shuts a school down, then, and they go remote, then there is no athletics at that school either. Secretary French?
Yeah, firstly, I would just say, outbreak, this word, we haven't seen necessarily outbreaks at school. We've seen cases and situations, but not necessarily outbreaks. But when the cases are identified, we do, sort of the EPI team goes through their typical contact tracing process and so forth and advises the school on what to do next. There have been situations where that process has impacted the operations of a school or related schools because of the necessity of people to quarantine or isolate and so forth. But those circumstances aren't directly connected to the ability to offer a game or to hold a game. There have been situations where a school has shut down part of its operation due to logistical concerns, not necessarily directly related to the virus, but still held athletic competition. So, you know, again, just to give you a sense of the nuance involved, those things are evaluated very closely, and school districts are given specific advice on their situation.
It might be helpful as well if I had Dr. Levine explain what an outbreak is, because it's not, it's in some cases, not as dramatic as it might appear.
Thank you, Governor. In fact, in most cases, it's not as dramatic as it might appear. It is an epidemiologic definition that has to do with the setting that the cases are in and the epidemiologic linkages amongst cases. And in some settings, 2 cases constitutes an outbreak. And Greg, you probably noticed on the list that we sent to you, there are a number of situations that are listed as worksite A or worksite B and don't have a number of cases assigned to them because, again, they are so small a number that they would be identifying otherwise. So the school situation is such that you can have 3 individuals in a school and have an outbreak, yet that is the limitation of the entire number of cases there. And in fact, minimal, if any, number of people might even have to have quarantined because of those 3 cases, depending upon the circumstances. So quite often, that does not result in a closing of any classroom or school at all, or going to remote learning, which would, as the governor just indicated, immediately force the school to cancel all of its athletic competitions. So that is the way it's sort of put together. So I would doubt that there was a school that had an outbreak that closed it and put it into remote and then played sports the next day, because that would be directly in contradiction to all of the guidance that we've provided all along.
I still don't think I got an answer, though, as far as are parents notified if their kids are being bused to another school that has very recently had an identified outbreak?
Yeah, I don't believe.
I would just.
I don't believe that's done by any requirement or any existing guidance. Obviously, everyone at the school itself knows, because the school staff are really very good about conveying that information through their community to all of the parents and families. But again, it'd be, again, like if you knew about a work site that had a case, but they were still open for business, you could elect to boycott them and never go to them, or you could understand that because they had one case that was acquired in the community that's now been removed from the work site, that the work site is in fact quite safe. And everybody has been questioned, and everybody understands if they are a close contact or not. Probably safer than the place where you don't know that there's a case that's there, and nobody's been questioned, so nobody's thought about it. So again, you have to use this information very, very delicately, if I could use that word, because quite often no one is at risk. And if people were at risk, that process has already been gone through where we've notified everyone who's at risk.
Certainly. Okay. Moving on to my second question here, because I don't want to take too much time. Governor, is it your intent with the current travel policy to continue to require fully vaccinated people to quarantine for 7 days and get a test? Or does being fully vaccinated free someone from that part of the executive order?
I guess I'm not understanding the question. I think what I announced today would do just that. If you are fully vaccinated, first, second dose in 2 weeks, you can travel without quarantine. And if you come in contact with someone who is infected, you don't have to quarantine either.
Okay, thank you for that clarification. Okay. My reception was a little bit broken, I think, when you announced for that.
Okay.
Thank you. And thank you, Governor. Thank you, staff. Have a great weekend.
Devin, Local 22.
Yeah, my question is about a store in Newport. UPS severed its relationship with it because they refused to comply with the mask order. They had warned them, or the Attorney General had sent them a letter back in November, and then another one on Wednesday. The store ultimately ended its relationship. They had a sign posted on their door that said, "We choose not to wear a mask. If you're uncomfortable with this, we ask that you do not come in." What is your reaction, Governor Scott, to sort of the messaging that this store was putting out, saying that they're choosing not to wear a mask despite the mandate? This seems to be an issue that's been pretty few and far between in Vermont, but something that has been kind of a hot button topic nationally. What's your reaction to that?
Yeah, this was in direct violation of the guidelines that we put into place. That's why the Attorney General was involved. We did see this on social media. We looked into it, tried to repair the problem, tried to give guidance, and the guidance wasn't accepted. And it appears the corporate UPS decided to get involved themselves and actually appears took away their franchise. The unfortunate part from all of this is it was avoidable. If they just complied with the guidelines we put into place, and as the UPS corporate had asked as well, they'd be open today. And I'm hoping, and again, this is out of my control, they were in violation of their franchise agreement with corporate UPS, but it'd be my hope that they could find a path forward to reopen following our guidance. We don't want to shut any businesses down.
All right, thank you.
Lisa, the AP.
Thank you. When we get to that group of Vermonters with chronic underlying medical conditions, will you be further breaking that group down by age group, or is the entire group, will they be all eligible at the same time to sign up and get vaccine?
Yeah, we're considering all of that, and we'll have more details on that in the very near future, long before they're able to sign up, but we're considering all that. We just want a seamless process that's easily understood and gets us to the end as quick as possible.
Okay, thank you.
Kat, WCAX.
Hi, got another question about the long-term care facility guidance changes. Just wanted to absolutely clarify for a viewer who wrote in and was confused. People from outside facilities are, if they are fully vaccinated, are now allowed to come into the facilities if that facility allows it, correct?
Kat, if the facility allows it, you don't have to be vaccinated to come into the facility. I think Calvin asked a similar question, that what we are saying is that because the person inside the facility is vaccinated. Now, it can be one of the criteria, but I would suspect most will just keep in, we have the resident vaccinated, and visitation policies, indoor visitation policies, I think, will remain, that we won't require people coming in to be vaccinated.
Got it. I wanted to clarify because we did get a couple of emails after the questions were asked earlier wanting us to clarify that.
Okay.
And the next question I had on that front was, what is the way that the state is going to be advising these facilities on what's the appropriate way to gauge the safety of certain measures that they roll out? Are you going to be giving them specific, like, here's what we recommend you do, or is it the type of thing where each facility gets to, have a pretty broad leeway with what they choose to have as their policy?
There are two ways that we're going to be doing this. One, the skilled nursing facilities have to still adhere to the CMS guidelines, and we've sort of worked around those worked in conjunction with those guidelines in order to be specific. We're going to be releasing a whole set of guidelines for all long-term care facilities. In that, we're going to be holding discussions with those long-term care facilities to make sure that we answer every single question that they have. And I think that's going to happen next week as we roll out these guidelines.
And will those be online so that people who are curious can go see them?
Yeah, I'll try to make sure that they're online, Kat, so that anybody can see them.
Thank you very much.
Aaron, BT Digger.
The Vermont Supreme Court upholding the constitutionality of the state law on gun control.
I don't know if I got the whole question.
Do you have any thoughts on the Vermont Supreme Court upholding the state law that bans high-capacity gun magazines?
Oh, I hadn't heard that, actually, Aaron. So,
okay.
That isn't,
yeah, I guess it
yeah.
is a relatively recent. Mm-hmm.
That doesn't surprise me. We thought it was constitutional from the start, but doesn't surprise me that they found it so.
Mm-hmm. Mm-hmm. Yeah, just to kind of clarify, the court wrote in issued ruling today. We conclude that the magazine ban is a reasonable regulation of the right of the people to bear arms for self-defense. This is the law that was signed in April 2018 in response to the alleged school shooting, or after the alleged school shooting fought in Fairhaven.
Yeah, again,
Any additional thoughts from that, or?
Yeah, unfortunately, Aaron, I didn't hear all of that once again, but I support anyone challenging the constitutionality of any law that we might put into place. It's fully within their rights. They did so, and the Supreme Court appears to have upheld that. So again, we thought it was constitutional from the beginning, and the Supreme Court appears to have agreed with us. So. Again, I support anyone's right to at least challenge that.
Okay, thank you.
Tim, Vermont Business Magazine.
Hi, good afternoon, Governor. I have a general economic question for you, and I was wondering after Commissioner Harrington can update us on when the good 1099-Gs will be going out. But as far as the economy is going, the revenue report was pretty good that came out earlier this week, especially on the personal income tax. That looks pretty good. The ski areas, look, they're having really a surprisingly good season. The snow has been phenomenal. Cases have been low, and so I'm wondering, and the national economy seems to be softening. I'm wondering what your take is on the Vermont economy now, given sort of early results.
Well, again, I would go back to while our economy has improved over the last number of years, 3 or 4 years, as reflected in some of our budget and the surpluses we've seen and so forth, it still isn't as good as it should be. That's why we put in a lot of the measures in place. We want to grow our economy. We want to make Vermont more affordable. And we put a lot of issues forward that the legislature has agreed to and come up with some on their own as well. So we work together to improve the economy. It's got a long ways to go. But if you're comparing to what we had before to what other states might have had before that had stronger economies, theirs has probably softened. Ours has improved. And I believe that if we do things right, and especially with some of the surplus funds we find ourselves with, the one-time money, a couple $100 million, if we invest those in the right areas, I think we can have an even much more improved economy, a stronger economy in the end. So that's why we're working so hard to try and identify those areas where we make those investments with one-time money to make strategic decisions about improving our economy in the future.
I was kind of thinking of just anecdotally, this moment in time, how are you feeling about the local economy?
Again, it's much better than I thought it was going to be.
You sound reluctant.
Yeah. Well, no, I'm hesitant because it's supported by an influx of federal money. So this is we're in good shape today, but this isn't a real solid foundation. This is built on billions of dollars of injected federal money into our economy that's helped us. The trick is to make sure that we come out of this when the federal money's gone so that we can support ourselves, stand on our own 2 feet. So these strategic investments I've been talking about are vitally important to being able to accomplish that in the future.
Okay, great, thanks. If Commissioner Harrington has an update on the 1099s, that'd be great.
Hi, thank you, and thanks for the opportunity to share the information. Right now, we're still on track to have the new 1099 mailed out by the end of the month. Our extension that we requested runs out the first week in March, so we should be able to get the 1099s out before our extension expires.
Okay, great, thank you.
Thank you.
Derek, 7 days.
Hi, my first question is for Secretary Smith. I'm wondering if these forthcoming long-term care guidelines will require or recommend that a home have a certain proportion of its staff vaccinated before they relax these visitation restrictions. And I ask that knowing that we've seen how outbreaks among staff at these homes have created critical shortages that can affect the quality of care.
Yeah, we're still maintaining the regimen of the pretty rigorous regimen of testing in long-term care facilities, and we've had great response in terms of those staff that have gotten vaccination. In our guidance, we aren't requiring vaccination. It's going to be an individual choice, but that is staff and residents. Now, like I said, we've had tremendous uptake on the vaccination, and I think it will continue as we move forward. But we have not required that they be vaccinated. That's an individual choice.
Okay, and so the guidelines won't say, you know, the state recommends 2/3 of your staff be vaccinated before you do X, Y, or Z.
No, we recommend that you be vaccinated. We're not we're not putting any criteria on that. As I said, three-fourths of the staff have been vaccinated. I think I said 3/4 of the staff have been vaccinated, and we'll go. Yeah, nearly 3/4 of the staff have completed their first dose, and half the staff have completed their second dose.
Great. My other question is related to the new travel rules for folks who are vaccinated. Is that going to be an honor system to prove that you are vaccinated, or does the state issue any sort of proof of vaccination card that people could carry with them?
There is a vaccination card. All states should have this. It's federally issued, I believe. And I may ask Dr. Levine to explain further, but everyone should have the card with them whenever they travel in or out of the state and be prepared to show it when asked.
All right, that's all I have then. Thank you.
Greg, the Bennington Banner.
Hello, Governor. Good afternoon.
Good afternoon.
On Wednesday, lawmakers who gathered for a news conference on opiate overdose deaths in Vermont said that COVID relief dollars ought to be used for addiction treatment because the pandemic has contributed to the increased number of relapses, overdoses, and deaths in the state. Would you support the use of upcoming COVID relief dollars for opiate treatment and counseling?
Well, we'll certainly reflect on that. We know we have our challenges in terms of the opioid crisis. The pandemic has had a bit of a detrimental effect on that, and we're concerned. We've now put into place a chief prevention officer in our staff. It was former Commissioner Monica Hutt is now on the fifth floor with us and as our liaison. And as well, I've spoken to Secretary Smith about upping our efforts in this regard to get back on track to get the treatment that we need. Secretary Smith.
Thank you, Governor. We've recognized that the pandemic has isolated people, and in those isolated cases, we've not had the results that we want in terms of opioid deaths. We have, we did a really good job up until when the pandemic hit. We were trending in all the right directions into that, and then the pandemic hit. And the biggest factor, I think, is isolation. We've put into place various ways of people connecting with us. Commissioner Squirrel from the Department of Mental Health talked about a couple of those, but we are putting together a task force within the agency and coordinating with the Chief Prevention Officer, Monica Hutt, in order to make it a statewide effort in order to redouble our efforts in this area. We can't lose ground, no matter pandemic or not, into this, and we need to address this this situation as we move forward. Dr. Levine, do you have anything, or did you? Okay.
As Secretary Smith said, there'd been probably a 5 or 6 year continued growth in opioid overdose deaths, and then the year before the pandemic, we had a dramatic decline, actually. That coincided with a lot of successful programming. All of that programming has gone on, and as Secretary Smith has just said, the root cause is really the isolation produced by the pandemic. The fact that people, first of all, vulnerable individuals who are already in the thralls of substance misuse were confronted with a pandemic and the extra stress that could provide, potentially increasing their use. Secondly, the fact that being alone, they had no one to rescue them if they overdosed, so that there was a lack of a structure with friends who would look out for each other because they were isolated. And then thirdly, amongst many other reasons, the fact that their usual supply chains were disrupted and they often did not know what was in the product that they were purchasing. So all of those things contributed to the reversal of the good fortune we'd had the year before. But I don't want people to think that nothing else was going on, because we've been really pioneers in the rapid access to MAT program. And during the course of the pandemic, we've actually expanded the number of hospitals that now can provide immediate access to buprenorphine for those who are agreeable and want to take that at that time. We've also expanded the number of syringe service programs that are poised to provide MAT to their clientele through that mechanism. And they have a fairly robust clientele that connect with them and are trusting of them. And when they are prepared to take MAT and start buprenorphine, they now have a ready avenue to do that. And I don't want people to think that the substance misuse treatment system shut down because of the pandemic. Those who went to our hubs continue to go to our hubs. And in fact, we're able to go to the hubs in a more relaxed way, if you will, not having the requirement for the intensity of their visits to the hub. They could have take-home doses, things of that sort, that would allow them to, again, protect themselves in a pandemic, but still be on the appropriate treatment. Those who went to spokes didn't always have to have face-to-face contact with their clinicians. They were able to actually get provided their monthly buprenorphine prescriptions without having to travel and, again, be in face-to-face contact. And those systems have continued and are actually enrolling more and more people all of the time. So it is a tragedy that we have had a pandemic and that the fortunes that we'd enjoyed for a year were reversed so quickly. But I don't want people to think that all systems shut down. This system has continued to go on, and there's a lot of dedicated people who either in person or remotely were delivering services through the treatment centers, through the recovery centers, et cetera.
Okay, I had 3 people answer my question, so I don't think I can really ask for more. Thank you very much.
Avery, WCAX.
My question is likely for, my first question is likely for Dr. Levine. We were forwarded a letter from a UVM parent that said that the UK variant has been found on the campus, but we were confused as to whether that meant in the wastewater in Burlington or whether it was discovered with a test of a person.
Yeah, if that letter's correct, that parent has way more insight into situations than the entire campus administrative community and the state of Vermont, and must have sequenced something on their own. All we have is the 2 mutations that were found in the wastewater. None of the subsequent genome sequencing specimens have shown the variant, but I will say we still have more to test. And 3 days from now, we're going to get more results back, and we'll see what they show. So it's still pending. I would not want anyone to say with certainty that we found in the nasal secretions of somebody the variant virus, and that was proven by genome sequencing.
Okay, my other question is likely for Secretary Curley. We've been receiving a lot of messages and emails from people who are part of social clubs like St. John's Club concerned about why they're not allowed to open, but restaurants who serve food are allowed to open, whereas at social clubs they also serve food. Is there any guidance that the state can provide for these types of social clubs?
Secretary Curley, are you on?
I sure am. Thank you. Yes, we do have guidance for social clubs to operate. If they are able to operate as a restaurant, they need to follow the restaurant guidance on our WorkSafe, on our webpage at accd.vermont.gov. They also could operate under a section for indoor entertainment if they wanted to host a bingo, for example. They could also have a blood drive or be a vaccination site. So there's a variety of ways that they can operate. Currently, they are unable to operate in the traditional club setting, social club setting, due to our multi-household gathering prohibition. But there are a variety of ways that they can operate during this time.
Thank you.
John, BPR.
Thank you. I saw a headline this morning in the New York Times where it says states are finding hidden stashes of the coronavirus vaccine, and these were supplies that were set aside for nursing homes, and now and haven't been used, and many states are trying to get that in order to boost their own vaccine efforts. And I'm wondering, is that a situation that we have here in Vermont? Are we finding hidden stashes?
Yeah, I don't know if I don't know if I would describe them as hidden stashes, but we are finding there is some inventory that we are going to bring back into the fold and put into use. I'll let Secretary Smith talk about that.
John, we've found through the long-term care, the federal long-term care program, that there has been doses that have been left over. We've collected 2,800 doses from CVS, and we're in the process of getting back 7,000 doses. Those are first and second doses from Walgreens that haven't been used. As you know, we used our allocation to give them portions of our allocation up front in the beginning of the 1A phase. Now we're starting to recapture those doses back into our systems, and we've received the 2,800 and have immediately redeployed that, and we are looking at getting the 7,000 first and second dose back and redeploying that as well.
And so these doses are now, are you figuring them into your calculation of sort of the time frame for the next age band, et cetera? Does it allow you to move things up a little bit, or has it allowed you?
Yeah, we got to be a little bit careful with that, John, because it's one time. It's a one-time bump. So we're figuring it into our calculations in terms of our age banding, but at the same time, we're looking at a more sustainable flow that's coming in as we move forward. I think, next week it's like 13,000 doses. It's over 13,000, but I don't have the precise number with me.
Okay. And then under the new policy that if you're quarantined, I'm sorry, if you've been vaccinated, you don't have to quarantine if you've been out of state. But would folks still have to or still be unable to visit other households, other families? I know you're addressing that later on, but folks could be vaccinated but still be unable to meet with friends and family.
That's correct.
Come back.
Yeah, that's correct, at least for the time being, and that's exactly what I was talking about. It raises a lot of questions, the what ifs, the what abouts, and we're going to address those next week. The travel policy goes into effect on Tuesday. Hopefully we'll have a lot of these worked out Tuesday or Friday and be able to answer those questions. But that's exactly what I was talking about, that it will lead some to reflect on, well, why not this? And we just can't answer that right now. What we want people to focus on is your ability to travel in and out of the state without quarantining if you've been fully vaccinated plus 2 weeks. And then we'll consider all the other questions that might come along, and I'm sure that we'll get a number of them over the next few days. But this is why we want to take our time, make sure we get it right, so that we can clearly define what we're doing.
Thank you very much.
As well, I'd like to go back just for the inventory that was found in some of the pharmacies and so forth. As you might remember, this was an area of concern for me. I think it was Tuesday when we heard that I heard from the Biden administration that they were going to double the amount of vaccines for pharmacies and long-term care facilities. And I'm very concerned about the federal government getting involved in some of the contracts that they want to do and utilize. We would like to have more control over our vaccination plan because these types of situations wouldn't happen if we had the control of the supply funneling into the state. We want to have partnerships. We want to work with the pharmacies and the FQHCs, but we'd like to know where that vaccine's going and how much they have, and make sure that we're utilizing it to our fullest advantage. So this is one area that the governors, myself, the governors across the country, both sides of the aisle, are raising a red flag here because this could be problematic for us as we try and distribute as much as we can, as fast as we can.
Thanks.
Joe, the Barton Chronicle.
Hello. I don't know whether this is a topical question or not, but when there was the conversation about antigen testing earlier, it occurred to me that someone who's been vaccinated might show up as positive on that. I could be wrong about it. But if that is the case, can the antigen test be used over time to monitor the length of time that a vaccine remains effective?
Dr. Levine.
I'm going to have to sort of self-interpret your question, Joe, but let's say a person's been newly vaccinated in a 2-dose vaccine and they've gotten the first dose. There is a possibility that person in the next week or two can actually contract COVID and test positive on any test, a PCR test, an antigen test, you name it, because they're in the period of time where their own immune response hasn't yet gotten to the point where it would be totally protective. And we have seen that in just a very, very small number of people in Vermont and certainly a greater number of people around the country. So the test is still the test. And if there's enough viable virus in someone's nose, then the quantity is there, the test can detect it. The goal is that once your immune system has really done what it's supposed to do in response to the vaccine, that you can repeatedly use an antigen test on somebody in their nose and not find any virus. If we believe the AstraZeneca data, 2/3 of the people in their trial did not have any virus detectable on testing after vaccine. And that tells us a lot about how much you might be able or not be able to transmit the virus to someone else if you've been vaccinated. The UK is now doing a study where they're actually subjecting someone in the study to getting the virus, by having them breathe it in, and looking at the same question with regards to vaccination. And they've been able to get that through their ethics apparatus, and we'll see what kind of results they get from that. If you're asking 6 months from now, after somebody's been vaccinated, could you keep using an antigen test to see if they, still remain immune? Probably wouldn't be a great use of that test at that time unless they had symptoms. I wouldn't just do it in a surveillance way. And if, on the other hand, you're talking about antibody tests, those are, blood tests as opposed to the swab in your nose. Certainly antibody tests would be able to detect if you have some level of immunity, but nobody really has done the studies yet to see if it's worth looking at a population-wide basis, blood samples from people over time. I'm sure those are going to be done as part of some of the trials, but we don't have any real insight into that just yet. So I hope with that sort of lengthy answer I covered what you wanted me to.
I think you did. I obviously had a misunderstanding about antigen and antibody tests. But you think that the continuing studies that allowed the emergency use authorization will do the kind of work that in the end will show how long a vaccine is effective for?
Yeah, I do, and I really think that's a critical question. So we need answers to that. Obviously, it brings up all kinds of issues about boosters and things of that sort. So we need those answers, and those will be forthcoming. I can tell you, though, right now, nobody is doing routine antibody testing after vaccination in the immediate period. So you get your dose, or you get your 2 doses, depending on which vaccine. There's no requirement or intent that you get an antibody test to check on what happened or didn't happen. We will assume you are vaccinated and that you hopefully have a higher level of immunity to the SARS-CoV-2 virus than you did before the vaccine.
Thank you. That's very clear.
Ingrid, Valley Reporter.
Good afternoon. I believe both my questions are for Mike Smith. If someone is vaccinated, is eligible to get the vaccine, and they move to Vermont, what constitutes residency? Does someone have to be a resident for a certain amount of time before they are eligible to get the vaccine? How is residency verified?
We have 2 criteria. One, you have to be a Vermont resident, and you have to self-attest when you sign up that you're a Vermont resident, or you have moved within the last 6 months and intend to be a Vermont resident. Those are the 2 criteria that we have. In both of those instances, you have to self-attest. We're hoping that Vermonters, and we know that Vermonters, in most cases, and perhaps in the vast majority of cases, are self-attesting truthfully.
I see, and there's no time requirement.
Well, you have to be.
My other question.
Yeah, you have to be a resident. To be a resident, you have to be here 6 months. But if you've moved within that 6-month period and you intend to be a resident, that qualifies as well.
Okay. And my other question is a follow-up from a question asked by Mike Donahue last Friday. Have you gotten an update on the VA vaccine distribution program?
I did. It was last week. I don't know if it's ongoing. They're getting, and I will check on that. But it is for those that are veterans and those that are 65 and over. And by the way, the more the better in terms of what we can do in this state for vaccination. But you have to be a veteran and you have to be over 65 in order to take advantage of the VA. And that's all I know, Lisa, right at the moment.
Okay, thank you very much.
Yeah, I want to, yes. It's not part of our program. It comes in separately to the VA. That's why I hesitate to talk, authoritatively about that program because like the governor was talking about, some of the pharmacy programs, like the Walgreens programs, it doesn't fall within our purview. So the VA program doesn't fall within our purview, and therefore I'm a little bit more vague about what is going on with the VA as opposed to the state program.
I see. Thank you very much.
Tom, Compass, Vermont. Tom, you have to hit *6 to unmute.
Can you?
We got the first part of that, Tom.
I'm sorry. My question goes back to the UPS store in Hardwick and really more about enforcement following up. We had a lot of readers who are curious what happens. We understand the process. The process is you first put the complaint into the portal, and the Vermont government then screens through those and tries to determine which ones are actually real and valid, and then goes through an education process with local authorities. From there, if it doesn't work out, we understand it also goes to the Attorney General's office. What doesn't seem to be as clear to folks is how much action is the Attorney General's office taking? How often do they do more than just write a letter? And have they done full enforcement on any violators?
Well, I can answer part of that. Thankfully, we haven't had that many that have elevated to the point the Attorney General has had to take action. But I can remember one in particular, and it was the Rutland Gym, and that actually went to court, I believe, and there was a decision made there, and it all ended fine from our perspective. And this one that I know of. Now, whether there's been others, I don't know. Commissioner Sherling might have more insight into this.
Good afternoon, Governor. You covered most of it. In almost every instance, there has been compliance gained as a result of a letter or letters and or discussions with either the Attorney General's office or some cross-section of folks from the Department of Public Safety and local law enforcement. So it's there just haven't been that many events, really just the one that we're aware of that required legal action. Everything else has been, that has been elevated, has been resolved.
Okay, thanks very much.
Tom, I don't know if I misheard you, but the UPS store in question, that was in Newport.
I'm sorry, it was in Newport. You're right.
Okay.
Thank you, Governor.
Yep.
Andrew, Caledonian Record.
Yes, good afternoon. Thank you. This is likely for Secretary Smith. You mentioned additional appointments being added next week to several towns, including St. Johnsbury. Do you have a number on how many appointments that increases, either in totality or by town? And why were these handful of communities selected for this?
The total number, I think, of slots, and that's all I have in terms of what has been added, is the total number of slots, is is around 800 total number of slots. And the reason it was added is we had some vaccine that we couldn't use.
Okay, and then somewhat on topic, have you been able to fold the doses that are getting directly allocated to the FQHCs into the state system, or how is that working out at this point?
Yeah, I think the governor had talked about that. That's a concern of ours, and I think it is actually a concern of coordination with the FQHCs. We've had a very good working relationship with the FQHCs and have allocated to some of the FQHCs actually state allocation. Now, as they roll on to the federal program, how do they sort of register? Do they use our registration system? How do we account for what's going on? Do we back off our allocation based upon what the federal allocation? How is this all coordinated? And the governor has mentioned this. There is concern across the nation with governors, as he had mentioned, that you start layering on different programs that aren't connected to one another, and the complexity of trying to keep all that coordinated becomes immense, depending on how many layers that you put on. So, to answer your question, we haven't figured that out yet in terms of what this is going to look like, what their allocations are going to be, how their allocations are going to be coming in what size, and how we coordinate all this.
So have those direct allocations from the federal government not yet arrived at the FQHC?
I don't think they have yet. I'll have to double check on that, but there is one that is scheduled to arrive. I'm not sure that it has yet.
Okay. And then second topic on the school music guidance. This comes from a reader who's associated with a school music program, wondering about the 30-minute rehearsal time limit and why sports teams can play games or practice for longer stretches of time than a music rehearsal. And they're wondering if there's any method to be able to practice longer than that, perhaps changing physical locations or waiting for the air to clear and then resuming rehearsal after a certain amount of time.
Secretary French.
Yeah, thank you for the question. Our music guidance came out this week. As I described, it is fairly technical, so we're really interested in feedback and ways we can improve it. The 30-minute rehearsal time limit does come from the national recommendation. And once again, we don't look at student activities on a comparative basis. We look at them specifically. So there's quite a bit behind looking at music as a discrete activity relative to sports. And not to get too technical, but there's some things around the aspiration and so forth of students playing various instruments that necessitates specific mitigation strategies for when they're using their instruments. So bottom line is that's kind of where we're at now. We're certainly looking for feedback as people begin to implement the guidance. The last part of your question, the only way I think we would permit extended rehearsals now is outside, and albeit the weather's not that great for that, but hopefully soon we'll be able to do more of that. Thank you.
Okay. Thank you, everyone.
That's it. Okay. Well, thank you very much for tuning in, and we'll see you again on Tuesday, hopefully with more good news.